I'm Dr. Jeanelle de Gruchy, and I'm Director of Public Health for Tameside. Unfortunately, our COVID rates across Tameside and Greater Manchester are now rising rapidly again, and almost all of the cases are the Delta variant. While most of the cases are in children, younger people, young adults, we are seeing an increase in infections in older people too. We're seeing an increase in cases of people being hospitalized for COVID and those in needing intensive care. So it's really important that people have their vaccination for protection against severe disease. We know that the majority of our cases are the Delta variant, and it is just so much quicker in the way in which it spreads. An infected person we're able to infect many more people than previously. We're now having a large number of outbreaks of COVID in schools and other workplaces. Many of our children are having to miss school, and business are struggling with outbreaks and with staff being off. So we really do need to do everything we can to stop the spread of COVID. Vaccination remains vital to stopping people getting really ill or dying from COVID, and it will also reduce the amount that COVID is spreading. So I'd like to strongly encourage all adults, everyone over 18, to get vaccinated. And it's important to have both the first and the second dose to really prevent severe disease from the Delta variant. We're doing what we can in Tameside to make it easier for you. To book your jab locally, just head to our booking site on the website, www.tamesideandglossop.nhsvaccinations.co.uk, or call your GP practice. Alternatively, you can book at one of the mass vaccination centres by visiting www.nhs.uk/coronavirus-vaccination, or you can call 119. Our vaccine van is continuing to visit the heart of our communities to make it even easier to get the COVID vaccination. If you're registered with the Tameside or Glossop GP, you can just turn up to the pop-up clinics with no appointment needed. So to get the latest schedule for the vaccine van, do visit our website. That's www.tameside.gov.uk/COVID vaccine. So COVID vaccination, 2 doses, that's really the most important thing that you can do. Then we all need to reduce the chance that we are spreading the infection. So please remember to continue with those basic measures of hands, face, space. Washing your hands, wearing your face covering, socially distance, and letting in fresh air. They're all really still important, and they're effective with the new variant as well. I'd ask you to please try to work from home if you can. Be cautious when meeting others. Try to do that outside and minimize travel. If you have symptoms of COVID, such as a fever, a new continuous cough, or loss or change of taste or smell, then you must book a PCR test. So visit nhs.co/coronavirus for information on how to get one of those tests. Then finally, we all need to test ourselves regularly. Please use the rapid tests twice a week. That's to check whether you may be infected with COVID but don't actually have any symptoms. Now, this can be the case even if you have been vaccinated. So you could still have COVID, you could still be infecting others. So please get yourself tested regularly. That's twice a week to make sure that you don't have asymptomatic COVID. To do that, get hold of one of the kits. We're giving test kits out in different community venues over the next few weeks, including at our pop-up vaccination sites and at Hyde Market on Friday, the 2nd of July. Or you can order home tests online or collect them from different venues in Tameside. That's any of our libraries, most of our pharmacies, and also you can get them from Dukenfield Town Hall. For details on when that will be available, go to www.tameside.gov.uk/rapid testing. So quite a few places that you can pick up those rapid test kits so that you can do testing twice a week. There are things that we can do to minimize the damage from COVID. Please, I ask you to particularly follow these guidelines at this time and help control the spread of COVID and get us back to normal.